More and more South Africans depend on and or benefit from social grants. This is due to the high unemployment rate in the country. Currently, South Africa's official unemployment rate stands at 32.9%. According to Stats SA, the percentage of individuals who benefited from social grants increased from 12.8% in 2002 to 40.1% in 2024. Statistician General Risenga Maluleke says the percentage of households that considered social grants as their main source of income increased steadily between the years 2009 and 2020.
The percentage of households that considered social grants as their main source of income increased steadily from 21.3% in 2009 to 28.8% in 2020 before falling back to 23.8% in 2024. We will remember that in 2020, that is the year that we had COVID and measures were put in place by government to provide grants that would cushion members of the public from loss of income.
The data also shows an increase in access to improved water sources in the country.
3/4, that is 76.8% of South African households have access to improved water sources in the dwelling or in the yard. That is when you look at combining the 46.4% in the dwelling as well as in the yard, 30.4%, we come to that 76.8%. Those who went to a communal tap, we can see, are sitting at about 8.8%.
Maluleke says that there's been an improvement in ensuring that most South African households have access to electricity. However, this data does not show whether these households have legal access or not.
We are saying that the percentage of households that were connected to electricity supply from the mains increased from 76.7% in 2002 all the way to 90.2% in 2024. And of course, when we look at the 77.3% of electricity nationally as a main source of energy for cooking, we could see that provinces like Limpopo were sitting at 34.3%, and of course 16.7% of households in Mpumalanga continued to use wood for cooking purposes.
The Stats SA household survey data also shows that 3/4 of South Africans consult public clinics and hospitals, while others have access to private healthcare facilities. The data shows that medical aid coverage was most common in the Western Cape and Gauteng and least common in Limpopo and KwaZulu-Natal. Nompumelelo Siziba, SABC News, Johannesburg.